Welcome to Ultrasound Trainings. We're going to cover in this lecture ultrasound physics. Some of the course objectives will be, by the end of this course, students will be able to verbalize what sound waves and frequency are. Students will be able to verbalize the different ultrasound waves. You'll be able to verbalize what reflection, refraction, and attenuation are in ultrasound physics. And you'll be able to verbalize the image formation in ultrasound physics. So you get a general understanding of how the ultrasound machine works and how the physics behind it creates an image. Why is this topic important? Well, to me, when I think of ultrasound physics, ultrasound really doesn't exist without ultrasound physics. So to me, it seems pretty important. It's important to understand the physics of ultrasound and how the images are produced. Knowing how to adjust and optimize images is just as important. It's a lot of what us as ultrasound technologists like myself do. Ultrasound physics is a fundamental aspect of understanding medical ultrasound. It involves the principles of sound wave propagation, transducer functionality, and image acquisition. You'll learn the nature of sound waves, the way they behave or their behavior when they encounter different tissues, such as the stiffness and the softness of a tissue and how the sound wave propagates through that. Also, one important note is that ultrasound does not move through air. So that's why we use ultrasound gel. It's an acoustic enhancer. It helps to get the signal from the machine to the body and back. Transducers emit and receive sound waves. Understanding these principles is crucial for optimizing image acquisition and interpretation in clinical settings. While the search results provide an overview of ultrasound physics, including the generation and behavior of sound waves, the use of transducers, by the way, you use different transducers for different exams in different parts of the body, the manipulation of ultrasound waves, and all sorts of things come into play with ultrasound physics. So sound waves and frequency. Ultrasound refers to just that. Sound waves, which are ultrasound, are above human hearing. Ultrasound refers to sound waves with frequencies greater than 20 kilohertz, which is above the upper limit of human hearing. In medical ultrasound, frequencies between 2 and 15 megahertz are commonly used. The frequency of ultrasound waves is inversely related to the depth of penetration and directly related to the resolution of the resulting image. So the deeper you go, the lower quality or resolution your image is going to be. Higher frequencies provide better resolution but less penetration, while lower frequencies penetrate deeper but have poorer resolution. Ultrasound waves are emitted from piezoelectric crystals, which all of the ultrasound transducers have in them. The crystals vibrate to create a signal, and the frequency of the wave is determined by the crystal's propagation speed. The wavelength of ultrasound is the distance between two adjacent wave peaks, and it limits the detail that can be detected in an image. The frequency of ultrasound is entirely independent of the tissue that the waves are interacting with. Transducers, which are what emit and receive ultrasound waves, can send and receive waves at different frequencies. The frequency of the ultrasound wave has a corresponding relationship with resolution and an inverse relationship with depth. So as we stated before in the last slide, the greater the frequency used, the lower the penetration. So it would be very superficial, but it will have a better resolution. So your images, everything up close, will be way more crisp than something with a lower frequency and deeper penetration. It has more obstacles in the body to get through. So there's many different types of ultrasound waves. Ultrasound waves are not classified into specific types in the same way as electromagnetic waves, such as radio waves or visible light. However, ultrasound techniques are used in various medical applications, each with its specific focus and imaging mode. Some common ultrasound techniques include A mode, which is known as amplitude mode, a simple one-dimensional scan that displays echoes as a function of depth, such as sonar, things of that nature. B mode, which is known as brightness mode, is a two-dimensional image that displays echoes as a grayscale with white representing strong echoes and black representing weak echoes. So this is what we use in diagnostic ultrasound studies, B mode. We also use M mode. Motion mode is what M mode stands for. It's a one-dimensional image that displays motion over time used to visualize cardiac motion or fetal heartbeats. As an echo tech myself, I'm very familiar with M mode. Also, Doppler ultrasound is a technique that measures frequency shift of reflected ultrasound waves to determine blood flow velocity. So the signal is reflecting off of the moving red blood cells. It's pretty crazy. 3D ultrasound is a technique that creates a three-dimensional image of the scanned area. It's used a lot in OBGYN and other modalities, but predominantly it grew to be pretty popular in OBGYN. Also, 4D ultrasound is pretty similar to 3D, but it allows for movement. It's a technique that creates a three-dimensional image in motion, often used for fetal imaging. These techniques are used in various medical applications such as abdominal ultrasound, obstetric ultrasound, breast ultrasound, and vascular ultrasound, and echo, among others. So just know the difference between the different modes and types of ultrasound waves. Reflection, refraction, and attenuation. In ultrasound physics, several key principles play a crucial role in understanding how ultrasound waves interact with tissues and propagate through the body. 3 of these principles are reflection, refraction, and attenuation. These principles are fundamental to the physics of medical ultrasound and contribute to the generation of high-quality images for diagnostic purposes. Knowledge of how ultrasound waves interact with tissues helps clinicians and sonographers interpret images, make accurate diagnoses, and optimize imaging parameters based on the specific characteristic of the tissues being examined. So, in other words, these are 3 types of things that you can encounter when different types of tissue or organs or artifacts come into play in an ultrasound image. So reflection is something that sounds exactly like, looking in the mirror. It's a reflection of a sound beam or a sound wave. Reflection refers to the process by which ultrasound waves encounter a boundary between 2 media with different acoustic properties, causing a portion of the wave to return to the transducer. The mechanism happens when an ultrasound wave encounters a tissue boundary. A portion of the energy is reflected toward the transducer, while the rest of it continues to penetrate deeper into the tissue. So, for example, when you're scanning through the body and you're in an area that has a lot of bony structures, ultrasound cannot penetrate bone. The bone absorbs the signal. So, especially, for example, if you're scanning echo, you're scanning between the ribs, you're looking at the heart. So you get a lot of reflection or mirror image artifact in that area because part of the signal is being absorbed by the bone and being reflected back to the transducer, while the rest of it continues to penetrate towards the heart for the image that you're trying to get. Echo formation, reflection is the basis for the formation of echoes in ultrasound imaging. The returning echoes are detected by the transducer and the information is used to create an image. So refraction. Refraction is the bending of an ultrasound wave as it passes through tissues with different acoustic velocities or propagation speeds. So just like in our previous slide, our mirror image artifact or reflection, it's kind of the same principle, but in this one, the beam is being bent. So think of a cup of water with a pencil in it. When you look outside of the cup, it looks as if the part of the pencil that's in the water is being bent, when it's really not. But that's how it appears. So the same kind of concept is happening here. When the mechanism for this is when ultrasound waves encounter a boundary at an angle and the acoustic properties of the tissues on either side of the boundary are different, refraction occurs. This bending of the wave may affect the direction and focus of the beam. So, clinical importance. Refraction is considered when interpreting ultrasound images, especially in areas where tissues have varying densities, such as near bone or interfaces between soft tissues. So if you look on this slide, there's an image here that explains what the beam is doing in the image. It's being bent by the signal. And now we get to attenuation. Attenuation refers to the gradual loss of ultrasound energy as the waves travel through tissues. The mechanism is the attenuation of ultrasound waves is caused by absorption, scattering, and reflection. Absorption occurs as the ultrasound energy is converted into heat within the tissues, and scattering involves redirection of the waves in multiple directions. Frequency dependence. Attenuation is generally greater at higher ultrasound frequencies, limiting the depth of penetration but providing higher resolution for superficial structures. So as we stated before, the higher the frequency, the less amount of depth of penetration you're going to get, but more resolution. So the image will be very clear and crisp the more shallow you go with a high frequency transducer, and vice versa for low frequency transducers. Clinical considerations would be understanding that attenuation is important for optimizing ultrasound imaging parameters and adjusting for variations in tissue characteristics, ensuring the desired diagnostic information is obtained. So here, ultrasound image formation. So we're going to discuss how the image is produced. So here it says ultrasound image formation is based on the pulse echo principle, where a transducer emits ultrasound waves that interact with tissues and return as echoes, which are then detected and converted into a grayscale image. That is a very well explained process in such a small sentence, should I say. So the transducer contains piezoelectric crystals, as we discussed before, that deform when electrically stimulated, producing ultrasound waves. So they start vibrating, they send out a signal into the body, they listen, and then they bring the image that's being reflected back once they're done listening, and it produces an image on the screen of the ultrasound machine. The time it takes for the waves to travel to and from the tissues is used to calculate the distance from the transducer, and the intensity of the returning echoes is assigned a relative grayscale value. So, ultrasound image formation. Ultrasound images are divided into 3 zones: the near field, the focal zone, and the far field. The near field is closest to the transducer. The focal zone is the thinnest and has the best resolution, and that can be adjusted. You can move the focal zone up and down on the image. And the far field is where the beam starts to broaden, diminishing the resolution. The image is created in real time with updates of the abdominal images averaging 40 frames per second. And the image quality can be affected by factors such as the speed of sound in tissues, the frequency of the ultrasound waves, the presence of artifacts like refracted waves, scatter, and specular and non-specular reflectors. There can be many things that occur in the images, but knowing how to properly either avoid them or adjust the images or optimize the images will help you in the long run. So in conclusion, ultrasound physics is very important to ultrasound, and it's good to know the basics of it and to understand it to get and obtain the best images possible. In ultrasound physics, the frequency of the ultrasound wave affects the depth of penetration and the resolution of the resulting image. Higher frequencies provide better resolution but lower penetration, while lower frequencies penetrate deeper but have poorer resolution. Ultrasound waves can be affected by 3 main processes: reflection, refraction, and attenuation. We also went over those. Reflection occurs when sound waves transfer from one medium to another, such as between 2 tissues. So knowing that the stiffness of an image is important. That also affects the resolution of the image and the different properties of the image. Reflection is a critical component of ultrasound imaging as it allows for the visualization of tissue boundaries and the creation of images of internal structures. Refraction describes reflection where sound strikes the boundary of two tissues with different impedance at an oblique angle. So it's bending the sound beam. Attenuation is the loss of strength or decreasing energy of an ultrasound wave as it travels through a medium. The attenuation coefficient of tissues is the relation of attenuation to distance and depends on the tissues that it traverses. Higher frequency ultrasound waves are subject to greater attenuation compared to lower frequency ultrasound waves. The image formed in ultrasound is made by tracking reflections and mapping the intensity of the reflected sound waves in a two-dimensional image. Ultrasound techniques used in various medical applications include A mode, B mode, M mode, Doppler mode, 3D ultrasound, and 4D ultrasound.